Hey guys, my name's Anna, and in case you weren't aware, I'm one of the year threes. I hope summer's treating you well and that you guys are enjoying all of your assignments. They look like they've been kind of fun. So, I am here to talk to you a little bit about the answer for the question about the 56-year-old female with the right CVA. She's in an inpatient setting, and so the proper answer should be as follows. One, you should take the vitals. Vitals are always required in an inpatient setting, and it's just really important to be able to monitor, especially after a stroke, to make sure that you're taking their blood pressure and heart rate and everything like that, and just really keeping an eye on that. The next answer is range of motion, especially with a CVA. As she's in an inpatient setting, that means that she's recently had the stroke and that they're making sure that they're doing everything that we can, I guess, to get her back to functioning as independent as possible, in order to kind of get her to be able to go home and to move into an outpatient setting. Or wherever she may need to go, whether that's a assisted living facility or whatnot. And so range of motion is going to be incredibly important, especially with her affected side, just to see kind of where she's at with flaccidity and any muscle tightness or anything like that. And it'll really help. You'll want to start with passive, obviously, but kind of get her engaged in that as well. And then hemi dressing and use of adaptive equipment are also an answer because, with her affected side, she's going to need those adaptive techniques, and it's going to be really important to teach her to dress herself. And with her age, hopefully her stroke wasn't too terrible, and being able to give her those techniques to continue to be independent are going to be super duper important. And you're going to want her to be able to dress herself before she goes home to live on her own or with, anything like that. Transfers are also going to be important. She'll most likely be in a wheelchair. And if not, depending on how much use she has in her affected side, it should be her left side. You're going to want to make sure that she's continuously aware of her left side because there might be limited sensation or, just being incapable of moving that side, especially directly following a stroke. Energy conservation and work simplification are also going to be really important. Just making sure that she's taking the time to rest and she's not overexerting herself so that she gets that proper time to heal. As far as assessments that you'll want to use, the FIM, the mini mental, and the COPM are all the answers for that. The FIM is just a really good way to assess their assist level and their independence and where they're at with that, and it's really useful and used in most inpatient settings as of right now, as I'm aware, just because it's more of a pre-post test, and you can really use it throughout the process of their recovery to kind of demonstrate that they're getting better, and that's really important not only for therapy but also just for billing and other things like that. The mini mental is important because with stroke, in the brain, you want to make sure that she's cognitively capable of taking care of herself, being able to cook herself food, and just those higher level thinking, and you want to be able to know where she's at, and the mini mental is a good assessment for that. And then the COPM is just another good assessment to use because it's really important to know the kinds of activities that your client finds important, and that's going to be able to help you gauge what to focus on more so after you've gone through the basics, the dressing, feeding, all of that kind of thing, and then making sure that your therapy is really client-friendly and client-focused, and having them help with the decision-making on just helping them feel engaged in their therapy process. So that's what I have. Good luck. I hope you guys have a good rest of your summer. Bye-bye.